changes and initiatives in place due to the COVID-19 pandemic. I think you're still on mute, Dave. There you go.
There you go. Okay. I thank you, Congresswoman Sherrill. I've been having a little bit of connectivity issues this morning as well, so I hope that everybody can hear me. I'm grateful to be here, and I'm grateful to share this information. As anybody who has been attending our community town halls knows, VA New Jersey healthcare system operates 2 medical centers and 9 outpatient clinics in the northern 14 counties in New Jersey. During the COVID-19 pandemic and now into what we're deeming our moving forward, recovery efforts, things have changed a little bit. Access to care has changed a little bit for veterans. And so what I wanted to do is just take 2 or 3 minutes to go through sort of what has happened since then. So since about July 13th, we have reopened our specialty care for veterans. And since about August 3rd, we've reopened our primary care and mental health care for veterans. And what we're doing is using approach. So we are somewhere between 25 and 50% capacity right now for those services. Also, what we're doing to ensure people stay safe in our facilities, I say people because not just veterans, we're talking about veterans, employees, contractors, anybody who enters the facility needs to know that they are safe in our facility. So we are screening at the entrances, requiring face masks, using our sort of proprietary vet text service so that people can check into their appointments remotely from the parking lot, priority care to match these different phases that we're going through. And then we're doing some environmental changes in our facilities too, meaning, those sort of plexiglass barriers, different signage, limiting visitors to the facilities right now. We've done away with our valet parking in East Orange, which some people would say is a good thing. But we've done away with that valet parking and moved to sort of an event style thing. So now there's no valet person getting in your car or handing off the keys, all of that stuff. And it seems to be working out pretty good. And of course, we've been pushing towards virtual care modalities as well, not the least of which is our VA Video Connect, which works out pretty well. Other really quick updates are pharmacy. So we're really trying to limit the number of people who enter the facility. So we're really encouraging people to use the mail order pharmacy system, which is fantastic. Full disclosure, I'm a vet. I use VA myself, and I get my medications mailed to me. It works out pretty well. What else do we have on the agenda here? That's kind of it. We've got some new drive-up services by appointment only, like things like immunizations and COVID testing prior to surgical procedures. Those are being rolled out. If you've been to one of our 2 medical centers, you've seen the tents out there. So those are being rolled out. That, in a nutshell, is kind of what we've been doing. I'm happy to take any of your questions as we go forward.
Well, thanks so much. That was great. And I think we have Amy back. Amy, you want to start it again?
Yes, thank you. During this virtual time, there's just, I switched Wi-Fi's just to say that. I actually went onto my phone, so hopefully this will work better. All right. May I start again?
Yep, please do.
You can hear me fine now?
I can hear you now.
All right, thank you. Perfect. Okay, so good afternoon, and thank you, Congressman. Let me start again. Good afternoon, and thank you, Congresswoman, and all the panelists for this opportunity to discuss resources for our veterans. My name is Amy Amoroso, and I'm the director of the U.S. Small Business Administrative Veterans Business Outreach Center, Region 2, which includes New Jersey, New York, Puerto Rico, and the U.S. Virgin Islands. The VBOC program is designed to provide entrepreneurial development services such as business training, counseling, and resource partner referrals to transitioning service members, veterans, National Guard and Reserve members, and their military spouses interested in starting or growing a small business. COVID-19 and the current pandemic has posed some unique challenges for our veteran business owners and even our aspiring entrepreneurs. The biggest word out there right now is pivot. And how do you pivot? What resources are available to make this happen in your business? Our center alone has assisted hundreds and hundreds of veteran business owners looking for capital, like the EIDL assistance or when the PPP was available. However, it was not just funding that was needed. Marketing, strategic planning, resources and research, and so much more was needed to make this pivot happen. Our centers are armed with toolboxes and multiple resources needed to assist our clients needs during this uncertain and unprecedented time, as well as daily business life. Some of the assistance that is always available in our center is that one-on-one direct counseling or mentorship, business planning and cash flow projection needs, how to access other sources of capital, marketing and planning guides, referral networks. We host multiple training webinars on a monthly basis. Another big question is SDVOSB and VOSB certifications, as service disabled veteran-owned and veteran-owned small business, and how that can assist on the state and federal procurement sides for our small business owners. Two of our top programs, Boots to Business and Boots to Business Reboot. They provide participants with an overview of business ownership and is open to transitioning service members, our veterans and their spouses. And some of these classes right now are mostly being done virtually, as well as some are taking place on transitioning military bases currently, if they are open. All these services and assistance are again at no cost to our clients, as VBOCs are currently funded by the U.S. Small Business Administration. So thank you for allowing me a few moments to highlight some of the programs and assistance that my center dedicates to our veterans, military spouses, and service members on a daily basis. We are here to assist all our veterans as they start and or grow their small business. Thank you.
Thanks so much, Amy, and thank you. I know just how tough it's been for our small businesses, and the Veteran Center is such a great resource to be helpful to our veteran-owned and businesses of spouses of veterans as well. So thank you so much. I really appreciate it. Next, we're going to hear from Scott on the services provided at the VA Vet Centers, who is eligible and how they are offering services during the COVID.
Thank you, Congresswoman. As she stated, yes, the vet centers are part of the VA. What we exist for are community-based readjustment counseling centers. Primarily what we're treating is combat-associated PTSD. Excuse me, we also treat MST, military sexual trauma, and we're charged by DOD with providing counseling support in bereavement for Gold Star families when you have a service member who dies while serving. Our eligibility primarily, like I said, is to combat veterans. We extend that service to their family as well, so we can treat the veteran, their spouse, their children, parents, siblings, whatever case might be, whoever needs help in getting that veteran back to being able to live a productive life as a civilian post-military. The MST criteria is very flexible on purpose. In any case, we don't have a discharge class requirement, so it doesn't matter if someone has a dishonorable bad conduct discharge. We can see anyone, and most of the time we'll work with them to see if we can get that discharge upgraded. We don't do the process ourselves, but we can help guide the veteran towards what they need to do that. In my position in outreach, I do things like this. Spreading the word keeps me busy because we are lovingly referred to as the best kept secret in the VA. Dave loves that. I also exist to connect veterans to services. So if they're interested in counseling, I make the connection over to making a referral to one of our counselors. If they need access to healthcare, I'm getting them in touch with Dave Brimmer to get them into VA New Jersey. If they need housing, I'm calling my contacts with SSVF providers like Dave Pearson and Catholic Charities to get housing rectified for them. If they need to file a claim, I can explain the process to, and then I'll connect them with a service officer to get that claim through. So we try to operate as a one-stop shop for whatever the veteran might need. And because we're part of the VA, we've got connections there, but because we exist in the community, we have connections to those resources as well. Right now, during the pandemic, we've had to shift all of our services to virtual. So we're doing a lot less outreach, which is hard for me, but everything has been over the phone, utilizing VA Video Connect when we can. We've done some utilization of WebEx, Teams, whatever we're able to do as long as it's cleared with the government, just to make sure we didn't have an interruption to services. We've continued with our groups, meeting virtually. Some of them, one of them actually, meeting over WebEx it's fun because it's all Vietnam veterans, so they're all up close in the camera and can you hear me? But we've done the best we can. And the other 4 vet centers in the state, I'm at Secaucus. There's Bloomfield, Lakewood, Trenton, and South Jersey, which is down in Egg Harbor. We all have the same mission. We all work together as well as we can. So if a call comes to me and you don't necessarily live in the area of Secaucus, that's fine. I will refer you to whatever the most convenient vet center is for the veteran or family, whatever the need might be. So thank you again. I'm happy to answer any questions about what we do if someone's interested in a referral. The most important thing about us is our confidentiality. Records for counseling stay within the vet center where you're being treated. They're not shared with the VA. They're not shared with employers. They're not shared with Department of Defense or National Guard. They stay in the vet center unless you authorize us to share them. It's the biggest thing that we can extend to those serving, either National Guard worried about deployability status, police officers, firefighters, EMS, someone who may have an effect on their job if they're found to be in counseling for PTSD. We can offer that security and sense of confidentiality for them.
Well, Scott, thank you so much. Part of my mission will be making sure your secret is out so people can get the treatment that we need. I really applaud you. We have had several mental health town halls, and this is a really trying time for everyone, but especially people who might be emotionally fragile or who need the support of the community. So please, to everyone on the line today, if you need some support, please reach out. So thanks again. We're going to switch gears a little bit to a couple of our nonprofit organizations that are serving our veterans community. First, David Pearson, who can talk about the needs he's seeing at the Catholic Charities Veteran Services. But David, I also want to thank you for all the work you do through the SOS stakeholder group, bringing in different organizations who serve our veterans together on a regular basis to network and exchange ideas. I know, as you know very well, those groups have been instrumental in our understanding in my office of all the different needs of veterans in the community. So what have you been seeing at Catholic Charities during COVID? Oh, I think you're still on mute.
There we go.
Yep.
I hope everybody had a great summer and everybody stayed safe from COVID. I'm Assistant Director of Veteran Services at Catholic Charities, and I guess co-chair of the New Jersey SOS Vet Stakeholder Groups. Now, Mikie, I don't know if you remember, but I think you remember, we were like the first, I think we did one of the first outreach groups for you. And it was a women's, group. And, from the stakeholders who wanted to thank you because you stayed and you fought with us. We see all the good, work, all the stuff that's going on, Fort Hood. You've been out there, you've been putting yourself out there, advocating for us. And as we know, the work's not done, not completed. But it's good to have somebody that thinks of it.
Thanks. I owe you a thanks because, as you probably know, Lucy came down to testify in front of one of my committees. And so I really appreciate all of your work introducing me to many members throughout the community. And for the work you're doing. Thanks.
And you didn't forget about us. That's the thing. You followed through. So again, we're very appreciated. So we do SSVF, supportive services for veterans families. There's been some changes in that I think I should mention. Due to the CARES Act and the Stafford Act authorizations, a lot of the restrictions or the criteria has been loosened. So it's really a good thing. So we can put somebody into a hotel a lot easier. if somebody doesn't have an eviction notice, we can start working with the client, which is really important. Courts are closed. What's somebody gonna do? So what we can do now, as long as they meet the financial criteria, they're a vet, and the homelessness criteria, prevention. So even if they're 1 month behind in rent, we can start helping them, and that's a big change, and it makes a difference right now. Because people start falling behind. What's going to happen, right? And is that once the courts open up, right, and then all of a sudden people have to go, they still got to pay that money. There's still a lot of work. There's going to probably be a lot of work on the back end of this. That's my guess. So, we've been doing that. We got extra funds, and we've been using them to increase our capacity to support our veterans during the pandemic. Our program continues to operate. We're still offering case management services. Everything's going on, but we're just adjusting to, the situation. Our veteran clothing closets are all operational, all three, in Patterson, Kearney, and Franklin. People are still using them. Our veterans, if anybody needs clothing, we have it. It's there. We share stuff. Our three agencies, which is Straight and Narrow, Department of Persons with Disabilities, and Catholic Family and Community Service, have worked through this whole thing also. Mainly our food pantries, right? This is the thing. I'm going to give you some numbers. I had to write them down because I'll forget them. In a typical month, Catholic Charities Diocese of Patterson gives out to 5,000 or 7,000 people, right? And this is three food pantries, one in Patterson, one in Dover, and also one in Franklin. In April, that went up to 11,000 individuals, from 7 to 11. In May 21st, the summer months, we gave out to 25,000 children, women, and men. That's a 5-fold increase. There's been a big demand for food. Since the start of COVID-19, we've given out 1 million pounds of food. And so we see that. There's still people. And that's not just for veterans, that's for veterans and people in the community. Hunger is a very big issue. And it's a shame that it is, but you see people coming in with a group of kids, and a mother with 3 kids and a baby in a stroller, and they don't have enough food. We've done really a lot of good things with our partners, our stakeholder partners. David Brimmer, thank you. We found out that the Paramus Vet Home didn't have any snacks in their vending machines because nobody can go in there. David came up with the idea. We loaded up the car with snacks, which money came from Catholic Charities and the stakeholders group, and we brought it to all the old guys who were totally happy, right? A lot of different things. Our other partners, Backpacks for Lives, they've been doing things like making masks and gowns. I think Lucy actually connected Backpacks for Lives with Damava, who's buying some of the gowns. That's Brett Alexandra and Alexa. I mean, just really great people. Our partners are great, so we're grateful for that. And, we're seeing still a lot of need. We send out food cards when people, we find out there's a family that can't afford something. We get donations, and, we send them out to people via the mail. So, anything we can do to help. And, we're still here and working hard.
Well, thank you so much. Thank you for the work you do. I know it's so important. I think I made a little feedback, but thanks, David. You've been there from the beginning. As you mentioned, you were one of the first groups to come in, and that's been so helpful. Next, we have Carmine Deo, Executive Director from Community of Hope, where they are focused on helping veterans overcome mental illness, addiction, and homelessness. And both of our last two guests here, Carmine and Geri, came to Washington last year to speak at a monthly breakfast hosted by the bipartisan freshman working group on addiction that I'm on. I invited them to talk about the opioid epidemic for veterans, and I was so grateful that they brought their insight to Washington. And if I know I thanked you again, but I want to keep thanking you because I got such great feedback, and I think you shared so much insight with us on the Hill. So this is an issue that I know is only being compounded by the mental health impacts of COVID, not only in our general population, but for veterans as well. So Carmine, what are you seeing at the Community of Hope?
Thank you, Congresswoman Sherrill, and I really want to thank your team as well. The invitation to participate today, but your passion for making sure that veterans' sacrifice is recognized and that they get the services they need to be healthy and well is just amazing. And coming to Washington was an amazing experience. It was so great for us to really talk about the needs of veterans there. Just wanted to mention Lucy Delgaudio is actually on our board as well, and so she's schooling us even more on the needs of women veterans and where we need to focus. And so I really think that many organizations like ours, like Catholic Charities, were up to that challenge. So we look forward to doing more work in that area. Many people know Community Hope's been providing housing and support services for the last 35 years. I'll talk today just about those related to our veterans. So we help primarily in 3 ways: homeless prevention, transitional housing, and affordable housing. So much of what David talked about in SSVF has been true for us as well as a provider as a contractor for the VA. But that focus is really housing stability planning and it includes temporary financial assistance. As David mentioned, we've been able to really help more families and help families for a longer period of time because of the additional CARES Act COVID funding. So it's been really essential there to be able to help more and do more for veterans and families in the community. And that our SSVF is actually 13 counties in New Jersey. I'm going to give referral information as well in case people need it. So I hope people have a pen and paper handy. But referrals for our SSVF can be made by calling 1-855-483-8466 or by emailing ssvf@communityhope-nj.org. Our second area where we've seen a difference in the COVID work is in our transitional housing program. It's a 95-bed transitional housing program on the Lions VA campus for formerly homeless veterans or for homeless veterans. And the COVID funding there has helped us to purchase PPE and other protective equipment there. Veterans haven't been able to stay longer. We've also really leveraged technology to be able to provide telehealth to those veterans that are on site. We're doing all kinds of socially distanced things. So to think that we'd have to give veterans iPads, even though they're down the hall, is just such an interesting new way to do things. But that's what we've all been doing. So we've been really fortunate in a lot of ways there as well. For that transitional housing program, and it's available to all veterans, referrals can be made by calling 908-647-5717. And finally, just want to talk about our affordable housing work. Again, people being housed and staying housed is so important right now. So we've developed over 100 units of affordable housing. We actually do have some housing available in Morris County now. And in that area, the eviction moratorium as well as rental assistance has been really helpful for veterans and their families during COVID. So, those have been really, really big pieces. Referrals to that affordable housing program can be made at 973-463-9600. So just want to say thanks again. I know people know how important homeless services are for veterans, but just want to make a plug for us continuing to do more during COVID and after COVID. So thank you.
Well, thank you so much, Carmine. I really appreciate it. Finally, we're going to hear from the medical side. And so I'm happy to have Geri Moss here, who's a clinician with Atlantic Behavioral Health's True North program. The True North program is focused on helping our servicemen and women readjust to civilian life, serving those dealing with anxiety, depression, PTSD, and substance abuse disorders, among other conditions. So Geri, what are you seeing in your patient population, and what suggestions do you have for our veterans who may be finding that COVID in particular is exacerbating their mental health concerns?
Well, thank you for having me. Thank you for Congresswoman Sherrill and your phenomenal team. As you can all tell, that I'm not able to be with you by video. We tried handstands, cartwheels, all the machinations, but couldn't make it work. So thank you so much for providing me with the ability to dial in. So as a therapist that works for a large hospital system, True North does service the veterans, their family members. We see the adult children of veterans, surviving spouses, and sometimes what happens is just the general population will call in for behavioral health services. And one thing I appreciate about Atlantic Health, the screeners will always ask about military or veteran status. And so particularly as we've seen an increase in anxiety and isolation and suicidal thinking because of COVID, those veterans who normally might not have been identified are now identified, and so they're referred to True North for behavioral health services. So at first we were just doing things telephonically, but we did open up for the veterans and their families. If they choose to, they can come to our office here in Florham Park, which is where we're hosting the patients. They can come for their initial intake assessment in person if they would like to, and you know they are provided with masks if they don't have them, but we take precautions and the social distancing, and then all of the other follow-up appointments would be on the phone. So that's been a huge help too for those that might have barriers of transportation. So the clients that we see now, they're coming from Morris County, Sussex County, Essex, Passaic, Warren, even Somerset counties, since everything is done over the phone. And then in the course of the therapy, what we're seeing is that maybe they're not connected to VA healthcare, and yet they need to investigate if they can enroll. So I'm constantly reaching out to the county veteran service officers and my panelists here, Scott, David, Carmine, David, and just to see if there's any other services that they need, or how can they be connected through through all of the community services that they offer as well. So not only do we provide the therapy, but we really want to encourage the vets to use those community resources. But the isolation has really been tough. So we know the vets and their families just appreciate even that telephone connection. So here we are in Florham Park, but as I said, we're able to service a wider geographic area to eliminate, that transportation barrier. But thank you so much for, spearheading these town halls and the ability to get that information out to the vets and their families.
Well, thank you. I happen to know how busy all of you are, so I sincerely appreciate you taking the time to get the word out. And thanks for all the work that you're doing. As everyone can hear, these panelists have just been so embedded in our community. Please reach out if there's any support that you need. So I just really quick before we go to questions, want to give a quick overview of Congress focused on veterans issues. So from a legislative point of view, I'm a member of the 4-Country Caucus that just started as we entered into this class. It's a bipartisan group of veterans serving in the House of Representatives, working to support veterans in really a nonpartisan way, not just on veterans issues, but really across the spectrum. So far in this Congress, I've co-sponsored 29 pieces of legislation related to veterans issues and worked on many issues important to our community. Some of the highlights, I was a proud co-sponsor of the Blue Water Navy Vietnam Veterans Act, which was signed into law, and the Homeless Veterans Families Act, which passed the House and we're waiting for the Senate. I helped lead the Pause for Veterans Therapy Act alongside author Representative Steve Stiers, a Republican from Ohio. This act would create a pilot program within the Department of Veterans Affairs to give veterans access to treatment derived from working in service dogs. I also passed amendments in the House to the National Defense Authorization Act to increase funding by $1 million for the Airborne Hazards and Burn Pit Center of Excellence in East Orange, New Jersey, and to the Veterans Access to Child Care Act to ensure that MSD counseling and care services are eligible for VA child care. So specifically focused on some of the areas for women veterans, I launched and I'm a co-chair of the Service Women and Women Veterans Congressional Caucus. We have doubled the number of women veterans in Congress. Before you get too excited, that means there are now 4. However, we are working to continue that because among other actions, we've successfully urged the military health system to add 3D coverage for TRICARE, 3D mammogram coverage for TRICARE beneficiaries. I was also proud to vote for the Deborah Sampson Act, which passed the House and would increase the number of gender-specific providers in Department of Veterans Affairs facilities, enhance privacy for women veterans within VA facilities, establish the Office of Women's Health at the VA, and improve the quality of care for infant children of veterans, among other things. We're waiting for the Senate to take this up. And in last year's NDA, it included a provision to improve collaboration between the DoD and the VA in women's health transition training pilot program. So you can't underestimate the importance of having our voices in Congress, and I specifically just appreciate so many of you coming down to educate Congress on all the things that we're seeing here in New Jersey that could support veterans. Just last month, during hearings on the NDA, we discussed the SPEAR Amendment. This is an NDA amendment that would establish a pilot program at academies to have the chief prosecutor making binding referrals on special victims cases to the academy superintendent. This is to take a pilot program only, just to see how it works, to take some of these cases out of the chain of command, which I really am advocating strongly for. After hearing from myself and Elaine Luria, another Naval Academy graduate, on the topic, 7 Republicans crossed over and voted with Democrats on this critical amendment. But there's always more to do. I always want to hear from our veterans community, make sure I'm advocating for the legislative issues that are most important and impactful to you. I have Schaefer Bagwell on the line today, who is my military legislative assistant in Washington, and he's always willing to talk to a veteran in the district on these issues. In the district, I'm incredibly proud of the outreach that my team does to help veterans. I consider this some of the most critical work that we do, and we have with us today Willie Tolba, my military and veterans liaison, who's also a Navy veteran, an active reservist who heads up this outreach. So you can reach out to me or Willie anytime if you have a veteran in your community that needs assistance with a federal program or anything that you think we can help with. My office has assisted over 150 individual veterans and families on a variety of federal benefits issues, including VA medical benefits, VA compensation, burial honors, debt relief, and emergency records requests. I spoke with a constituent today, for example, had medical bills from an ER visit that had gone unpaid by the VA, and we were able to help. Please let us know whenever there are opportunities to honor the sacrifice and service of our veteran community. I have really appreciated the opportunities to be with our community, to participate in events over Memorial Day. Last year, I attended the dedication of pavers to Vincent Hines, a World War II veteran in Madison, who sadly has since passed away, who parachuted into Normandy on D-Day. We took the time to honor our Vietnam veterans with commemorative pinning ceremonies at my town halls, and we have had the honor to be at solemn occasions with our Gold Star families to honor their loved ones. And last year, I went to Normandy to celebrate the 75th anniversary. My grandfather flew over Normandy on D-Day and then was later shot down over Normandy that August. So it was really wonderful to be there to honor our veterans. Finally, our focus here today is healthcare and COVID, and I just want to highlight in terms of the VA system, I visited the East Orange VA Medical Center in Morristown, Seabach, and met with Director Mikie. I have reached out to him multiple times during COVID to see how I can best advocate for the VA families, facilities that serve our district, and hopefully we'll have a meeting to discuss their needs in the event of a resurgence. During the COVID crisis, I pushed for increased funding for VA telehealth capability, which has been so important, and we've heard a little bit about that. And with respect to the state-run veterans homes, I've been working closely with the New Jersey delegation and Reps Pasquale and Gottheimer to ensure additional medical resources get to the long-term care facilities and to hold leadership accountable for failures in our VA long-term care system. So thank you so much. Thank you everyone on the panel today. Let's get to the questions and comments from all of the people joining us. You want to get started with some of the questions that were submitted for the event previously. And Willie, I think you're on mute. There you
go.
Okay.
Can you guys hear me now, right? Great. Okay.
Yep.
Okay. All right. Thanks, Congresswoman. I'll start going through some of the questions that were submitted online. So our first question comes from Dorothy from Nutley. She asks, how can local Rotary clubs help veterans?
Oh, that's a great question. I love the community coming forth to help our veterans. Our Rotaries really provide such an incredible service to the community at large. And earlier in the pandemic, I volunteered at a mobile food event in Madison that was a collaboration of a number of Rotary clubs in the district and was an incredible effort. So I would love to hear, Carmine and David, do you have thoughts on what our Rotary clubs could do for our veterans community?
Yeah, there's actually a bunch of opportunities. One of them, like you could, help like something like our clothing closet for veterans, clothing drives, winter clothing drives, gloves for the winter, and we distribute that to 7 different counties, and anybody can come in and get it. We always need men's boxers and women's underwear. Those are like 2 things that people don't like to donate because they want to give like a real nice coat, but they don't want to do the men's boxers, right? But actually we need the men's boxers more and the women's underwear. So things like that. You can be part of our stakeholders group if you'd like. One of the things we do with the stakeholders group, which I think is really helpful, we work like a clearinghouse. So you could say you're looking to help in a certain way. We forward it to our partner, Joanne Northgrave, who sends it out across the board, and you'll get answers back. Probably more than you want, but you'll get answers back. So, I mean, there's always to help. I know Community Hope, you have your walk, every year. There's a lot of really great things to do within our community.
Yeah, I'll just add a few more things, David. Great ideas. We would say food drives. We have people do food drives for us all the time. The clothing, any kind of housewares and bedding, setting people up in permanent housing. It's a big piece that really helps as well. So we take donations in a number of our locations of those types of things. Of course, supporting all of our nonprofits with our fundraising. So as David said, runs and walks and things that we could still do socially distanced. We really welcome that. Obviously, we welcome donations and support in other ways as well. For Community Hope, I would just ask people to go to our website. There's plenty of information there about how to help us specifically, but also help veterans in general. I would say also not just for Rotaries, but for all corporations. These are the kinds of things that we see companies do to help the veterans we serve.
That's great.
One other thing that I forgot, because I'm not plugging my agency, so I'll have to hear it later. So if you want to donate, you can also go to ccpatterson.org, and you can donate to like a multiple different programs. So you can donate a car, you can donate food, you can donate money, so to veterans or any other kind of service.
And underwear.
Yeah.
Well, thank you both so much. And Amy, are there any rules for businesses who would want to mentor a veteran entrepreneur?
Absolutely. Are you thinking of rules as far as already established agencies or veterans that are looking to network and mentor with other veterans?
So if we had members of our Rotary Club, our business community that wanted to mentor some veteran entrepreneurs, how would they kind of best engage?
Yeah, that's a great question. And I would love to entertain, I used to have something called the Veteran Networking Hour, where we would bring in agencies. I was even on a Rotary myself. I was belonging to our Rotary up here. I'm very proud of what we had done as well. And I love the Rotaries. I love their missions. But anyway, I digress. We can actually secure them. So I have veterans that call me every day looking for mentors. And we know we have something called SCORE, right? SCORE.org, to the federal government that provides those mentorships. Also, I have a lot of business owners that do contact me on a regular basis. They're looking to mentor. And I try to find a location for them to meet up with, and then they can secure that moving forward. Yeah. Great question.
Thank you all so much. Willie, you want to move to the next question?
So the next question, Jason, when is the VA going to implement the Mission Act? Several veterans have had appointments canceled over and over again and have not had VA health care for podiatry, dental care for March 2020.
I'll take that.
Yeah, I was going to kick that to you, David, because I got a lot of questions about this.
Yeah. So VA has implemented the Mission Act through our community care program. That was actually done back in 2019. So I think what Frank might be getting at is so when the Mission Act came out, what happened in VA was that our choice program went away. I think it was June 9th of that year. It went away, and it was replaced by VA community care. So when that happened, it was a dead stop for choice and an immediate start for community care. Roll out an entire nation's worth of third-party resources and things like that. So what we did was we leveraged regional sources that were already in play, and while we worked on what are they called? Contract vehicles for local regions. So we here in New Jersey are in Region 1, and so what that meant for us is that while we were negotiating our contract vehicle with a regional provider for healthcare services that would be working, kind of with VA to get these veterans seen in the community, we were using Tri-West, which is what the majority of the country, I think all of the country, was using at first. So what happened was we eventually moved to a different provider of those services, and we signed to that agreement, all of Region 1, so all of New Jersey, not just VA New Jersey healthcare system, but all of the state of New Jersey, as far as VA is concerned, uses that third-party provider now. So there was a learning curve, so to speak, because it was a brand new thing. There was a learning curve, and we kind of have those things ironed out now. Again, I mean, this seems to happen on every webinar, but, we do have to mention COVID. So right as all of this stuff was happening, we were hit with a pandemic. So then we had to figure out, okay, how do we take this brand new service and make it virtual and keep it moving and integrate all of that stuff as well. So we've been doing that. Veterans who have questions or comments or concerns about their access to community care have many options to help navigate that. First things first, and I'm never shy to do it, you can contact me and I'll help you. My email address is david.brimmer@va.gov. Okay. If you're already enrolled in the VA healthcare system, you can reach out to your providers. You can reach out to our community care office. We established an office, as all VAs did, to address community care issues and help navigate those claims and approve those claims. As far as canceled appointments are concerned, I don't know what the status is of that, but I don't doubt that some appointments were canceled because of the pandemic and things like that. So if veterans have appointments that were canceled and not rescheduled, they have options. They can reach out to the provider. They can reach out to the VA provider. They can reach out to one of our 5 patient advocates to get that kind of stuff resolved. And get those visits taken care of. So I hope that answers the question, Lily.
And I would just add too that they could also reach out to Willie. So my office is more than happy to help on that as well. And the number again is 973-526-5668. So yeah, please reach out if you have problems with Will, you want to do the next question?
Yep, absolutely. All right, I've got another question probably for you, Dave. So when and how is the Morristown CBOC going to open, and how are the safety measures going to be implemented when veterans have to travel through that Morris County nursing home in order to get to the CBOC?
That is a good question, and that's a timely question too, because I just found the answer out this morning. So I'm glad you asked. So this is like a sneak preview. So the answer to that question is a couple-fold. One, it will open when it's safe to open, right? So we can't just open the clinic, to physical appointments if it's not going to be safe to do so. So that's why it's been kind of closed. So as we're moving forward, what we're doing is we are not just letting the clinic sit there, we're prepping the clinic to open right now. So we're doing everything from installing, plexiglass barriers and things to, the distancing dots and the hand sanitizers, this stuff that you see everywhere nowadays. But also we're doing things, we're taking the opportunity to sort of upgrade the facility a little bit as well. So we're painting the walls, we're changing some of the furniture in there. As far as going through that nursing home to get there, what we're also doing is looking at how we can avoid that happening, right? So if we can change the entrance of the facility somehow, or if we can move that, that's actively being explored. So when is that facility going to open in Morristown? We're trying to have it open in the beginning of September. So the first 2 weeks of September, but again, it really depends heavily on whether or not it's going to be safe to do that. Because the last thing we would want to happen is to have veterans go to that clinic and either, contract an illness just by virtue of showing up to an appointment, or somehow bring an illness that they don't know they have because they're not symptomatic into that nursing home or something like that. So, that's a valid question, and just know that it's going to happen, and it's going to happen probably in the first part of September.
Got it. And then, Dave, just to clarify, all those providers at Morristown CBOC are working remotely, right?
Oh yeah, absolutely. So anybody who is missing their interactions with Dr. Madison and the crew there, those appointments are still being handled. They're just either working remotely, or if they really need to be seen in person for something, they can go to Lions and see a different provider as well. And we're happy to work with them for that.
Thanks so much. Will, you want to do the next question?
Sure. All right, Congresswoman, the next question, a few people submitted similar questions. They want to know a little bit more about what's going on with the PPP program for small businesses, and what's the status of a second round of funding.
So as many people have heard, we are right now negotiating with the Senate on the next round of CARES legislation. The House passed the HEROES Act, which was our next piece of CARES legislation, in May. And we have been waiting for the Senate to come to grips with what their next round is going to look like. They put something out as some of the programs were expiring, and now we're going back and forth because the sense is that their bill is not going to be enough to take care of some of the critical issues in the country. One of the big fights we're having is over state and local funding. And as you can imagine, there's really a bipartisan commitment in many areas to get state and local funding in when you're talking about all the work teachers need to be doing and first responders. In fact, Senator Menendez and Senator Cassidy from Louisiana, a Republican from Louisiana, have put forth the SMART Act in the Senate. I'm carrying that bill and leading that bill in the House with Congressman Pete King, from a Republican from Long Island. We've gotten a lot of bipartisan support for that SMART Act to get the state and local funding in there. So that's still a contentious issue right now. The good news is the PPP funding, a second round of funding, seems to have a lot of consensus around it. So we're still negotiating, but that seems to be an area where both the House and the Senate agree that we need a second round of funding. And so I'm on a number of bills to support that. The P4 Act, which allows small businesses to apply for a second PPP loan if they have under 100 employees and have seen revenue declines of at least 50%. It also provides guidance to lenders to prioritize underserved small businesses. The Bipartisan Restart Act provides small businesses with loans to cover the next 6 months of payroll, benefits, and operating costs if those small businesses have under 5,000 employees and have seen revenue losses of at least 25%. The Bipartisan Jobs Credit Act significantly expands the employee retention tax credit to help small businesses better recover payroll and benefit costs. And the Bipartisan Restaurants Act, which establishes and provides funding for the Restaurant Revitalization Fund, from which the Department of Treasury will make grants to eligible food and beverage purveyors to cover specified costs. Amy, do you have anything to add about resources for small businesses while they're waiting for this legislation to come through?
Yes, and I know the EIDL is still out there. SBA.gov has the EIDL program. It's the Economic Injury Disaster Loan Program. It is a loan, however, it is deferred for 12 months. The interest rate is 3.75% over a 30-year term. So if you do need some funding and you're waiting for this new piece of legislation to come out, please, try to go to SBA.gov, look up the EIDL lending. If you need the money now, it's available to you. The application is right there online.
Thank you so much. And that is unfortunately about all of the time we have for today. That went by too quickly, but we have such great panelists here, and we're happy to put you in touch with the services you need. I know everybody is working really hard on the complicated issues around COVID. And if we didn't get to your question today, please reach out. You can email my office at sherrill.house.gov/contact or call our offices at 973-526-5668. My website has a dedicated page for coronavirus that outlines some of the things we talked about and also has some of the contact information for the people and the programs you've heard about. You can also follow me on social media for the latest updates from my office. And I have a newsletter that goes out multiple times a week with coronavirus information, which you can sign up for at sherrill.house.gov. So thank you again, everyone. Stay safe, stay healthy, take care of yourselves, wear your mask, wash your hands, 6 feet. We all knew that, but also something else I'd like to plug is if you need help, if you need services, if you're just feeling just down and like you're not coping very well, please reach out. You are not alone. So many people are feeling the same way, and we have the services here to help you. So please reach out. And thank you all so much. Thank you again to our great panel. And you guys, just thank you for being on the panel today, but thank you more broadly for all the work you do for our veteran community. I sincerely appreciate it. So thanks so much.